Well, hello and welcome back to APHA's 15 on COVID-19 series. I'm your host, Dan Zlott, Senior Vice President of Education and Business Development at APHA. Today, we're going to be talking about dead space. We've been getting a lot of questions recently in light of all the discussion of dead space as it relates to COVID-19 and getting as many doses out of each of the COVID-19 vaccine vials. And so we're going to go ahead and jump in and explore that a little more deeply. As usual, I have nothing to disclose. Here are your learning objectives for today's episode. So let's go ahead and talk about what dead space actually is. So dead space is the volume of space in a fluid pathway, and for the purposes of today's discussion, the fluid pathway we're interested in is a syringe and needle system used to deliver COVID-19 vaccines, from which fluid is irretrievable. Now, this dead space results in lost or wasted drug product. You can't get it out of the syringe and needle. And most of the time, we really don't worry about dead space. It's so insignificant, we don't worry about it. However, in a situation where we find ourselves now, where we're looking to get as much drug as possible out of the vial to maximize the number of doses of COVID-19 vaccine that are available, we need to be careful and start thinking about dead space a little more carefully. Now, one other point about dead space, it usually, and this is especially true in syringe and needle systems, does not affect the dose that's delivered to the patient. So you don't have to do anything special to take into account dead space. The syringe and needle systems already account for dead space when you draw up a dose of vaccine. So now that we've sort of described what dead space is, let's try to represent it visually to help you get a better sense of what we're talking about when we talk about dead space. So what I'd like to do now is demonstrate for you visually the concept of dead space and how dead space actually works. So to help us with that, what I have here is a 3 cc syringe. This is just a standard 3 ml Lurlock tip syringe. The only difference is that instead of a needle like you would typically use, what I have instead is a what's called a blunt plastic cannula. So it's just a clear plastic cannula, and this is typically used by nurses in hospitals to draw up doses of medications from unit dose vials and to administer them to patients. For nurses, the advantage is that they help to minimize or prevent needle stick injuries. The advantage for us today is that this whole fluid system is clear. So that gives us a nice opportunity to actually see the fluid pathway and the concept of dead space. So I'm going to go ahead and insert this into a vial really quickly. So what I have is, this is just a vial of preservative-free normal saline that I've injected some dye into just to help us visualize the fluid pathway. So if this were a COVID-19 vaccine, I would go ahead and draw up my dose. And so depending on which vaccine you're using, that would be either 0.3 or 0.5 mLs. So I'm going to go ahead and draw up 0.3 mLs. So I'm going to go ahead and, as I draw this up, you may be able to see, let's see if I can turn around, right here, you can see I've got an air bubble right in the syringe. Now, typically what we would do is we just want to flick that, right, to get the air bubble to the top, and so we could push it back into the vial, redraw back down, and end up with a syringe full of fluid. Because of the concerns about disrupting the molecules within the COVID-19 vaccine, we're not supposed to shake the vial. And USP has also recently released some guidelines that suggest not to flick the syringe or the vial. So instead, what I'm going to do is I'm just going to draw up a little bit more, and then I am going to push this back, and hopefully you should be able to see the bubbles moving back up there. And I still have a little bit of a bubble on the stopper. You probably aren't able to appreciate that. You can see it a little bit right there, right at the little base there. What USP is suggesting is that small bubbles are okay. Now remember, we're injecting into the intramuscular space, so air bubbles are really not ideal, but a small amount is not going to be an issue. So I'm just going to go ahead and see if I can't get rid of that air bubble entirely, and I can already tell I'm not going to be able to. That's okay, but I have gotten that really large air bubble out of here. So what I'm going to go ahead and do is calibrate my dose, 0.3 mLs. And so now I have my dose all drawn up. So this would be, my dose of COVID-19 vaccine that I was ready to administer to the patient. And hopefully you're able to see the blue fluid in the syringe and also in the fluid pathway. So I'm going to go ahead and take that out of the vial. And in place of a patient, I have a nice clear plastic cup that's going to do a stand-in for us. So this blue plastic cup will just serve as my patient. So I'm ready to inject my patient. So I go ahead and administer the dose, and you can see the dose going into the patient. And so what I hope you can also see is that little bit of fluid that's left over in the syringe right here. So within all syringes is some dead space. And that's at the hub of the syringe, the hub of the needle, and then the barrel of the needle. So if I take my finger off the plunger, you can see that fluid go back a little bit just because the plunger is being pushed back into the syringe. If I depress that as fully as I can, like that, you can see that there's a whole bunch of fluid left in there. And that fluid that's left in the syringe, this is exactly what we're talking about when we talk about the dead space or the dead volume in a syringe and needle system. Now, for the purposes of COVID-19, this is very important for us because we're trying to get as many doses as possible out of each vial of vaccine. And you can imagine that I actually measured this particular setup, and this is probably more than you would experience for most of the syringe setups that you might use. But in this particular setup, there's actually more than 0.1 cc's of fluid or drug left in this syringe and needle. And so that's drug that we cannot, no matter what we do, get into the patient. So that's wasted drug. So you can imagine that if you're drawing up 4 doses, 5 doses out of the same vial using a setup like this, you're wasting, in this instance, 0.1 cc's every time you draw up and administer a dose. And so if you're trying to get 6 doses out of a vial and you're using a standard setup, you can see that this volume, when you add it up, you might be wasting 0.5 cc's, and that's certainly enough for an additional dose to get that additional dose out of the vial. And that's why the CDC, Pfizer, FDA, et cetera, are recommending to use low volume dead space syringes and needles. And so we're going to talk about that on the next slide just to help illustrate what that concept is and what those look like. But by doing that and by minimizing this residual volume, we maximize the chances that we're going to be able to get 6 doses out of a vial of the Pfizer COVID-19 vaccine, or all 10 doses out of the Moderna vaccine. So again, hopefully a nice visual representation of dead space for you. And so let's go ahead and go to the next slide and we'll represent that visually for you as well.
All right, well, now that we have a good visual idea, a good understanding of what dead space is, and we've actually seen it in a real live syringe, let's take a look at what we can do to minimize dead space. And let's start off by examining a typical syringe and needle system. So to start off with, in the hub of the syringe, we have a relatively large dead space. That's the part that the needle goes onto. In addition, on the hub of the needle, we also have a significant amount of dead space. And then there's a little bit of dead space in the needle shaft. That's unavoidable. It's always there. And it's usually pretty minimal, so you don't have to worry about that too much. It's really the dead space in the syringe hub and the needle hub where we can make the biggest impact. So one option is to use what's called a low dead space syringe and then a standard needle. So the way this works is they've redesigned the plunger tip so that it actually occupies a lot of space in the syringe hub to minimize the dead space in the syringe hub. However, if you use a standard needle, in this instance, you still have a fair amount of dead space there. And of course, you have that little bit of dead space in the needle shaft. It's unavoidable. There's really not much you can do about it short of shrinking the needle shaft. And of course, if you do that, eventually you shrink it so much that it's too flimsy to actually be able to administer intramuscular injections. So really, that's kind of a fixed quantity. There's not a lot we can do to reduce that. So that's better than the standard setup, but there's some other options as well. Let's take a look at those. So they, in addition to making reduced dead space syringes, they also make low dead space needles. And so here we still have the standard, relatively large dead space in the syringe hub. However, if you take a look at that needle design, you'll notice that there's plastic on the outside of the syringe, but there's also plastic on the inside in that little bit of the hub there. And that's where the arrow is pointing right there. So in this instance, the needle hub was redesigned to help minimize the dead space in both the needle hub as well as in the syringe. And as always, we still have a little bit of dead space in the needle shaft. There's just not a whole lot we can do about that. So this is a better option still. And the best option of all, if you can get them, are these one-piece low dead space syringe needle combinations. So the needle is actually integrated right into the syringe, and here, as you can see, the syringe and needle hub are redesigned to minimize dead space. So it's very, very low dead space. And of course, as always, we still have some dead space in the needle shaft. Nothing we can do about that. So those are the different options as you're thinking about low dead space syringes and low dead space needles. So hopefully that gives you an idea of what types of products to look for if you're responsible for ordering syringe and needle supplies. So how significant really is all this? Does it really make a difference? Well, let's take a look. So as we've already seen, each dose that's drawn up with a syringe and needle system with a standard dead space volume results in wasted drug. Now, depending on the particulars of which needle and which syringe you're using, there's somewhere in the neighborhood of 50 to as many as 100 microliters of dead space in those syringes. So for the purposes of calculations, let's just assume it's 80 microliters. That's 0.08 mLs of dead space. So in the case of the Pfizer vaccine, where you're supposed to be able to get 6 doses out of a vial, if you have 0.08 mLs of dead space in those 5 doses, you can see that when you add all that up, you're wasting 0.4 mLs total, which is certainly enough for an extra dose out of that vial. That's, if you don't use low dead space syringes and needles, that's just going into the trash. So again, we have limited supplies of vaccine, and we're trying to get as many doses out of each vial as possible to get vaccine into as many patients as possible. So here's a perfect example. And so just to give you a comparison of what a low dead space setup might look like, in some low dead space syringe and needle systems, the dead space is as low as 2 microliters, so 0.02 mLs. It's very, very small. And so when you add that up across 5 doses, you've got 0.01 mLs or 10 microliters of drug wasted. So that's not enough for a dose. So really, you're not missing out on any potential doses there. So very, very important for us to be looking whenever possible to use low dead space syringes. Now, of course, there's a shortage on these, so they may or may not be available. So be aware of that. But wherever possible, make sure to try to use low dead space needles and syringes. Now, we've talked about the equipment that can help you minimize drug loss due to dead space. Let's talk about some techniques that are also important to ensure that you're getting every dose possible out of a vial. So to do that, let's turn to Seth De Pasquale, who was kind enough to go into a pharmacy and actually record for us some of the techniques that he uses to get as much drug as possible out of a vial.
So let's talk about our technique for withdrawing as much liquid as we can from a vial. First, some basics. When you're entering the vial, you want the bevel of the needle to be facing up. Now notice that I have some empty space here in my syringe. You'll always want to draw back a small amount of air to put into the vial, but less than the amount of liquid you'll be withdrawing, so that the vial maintains a negative pressure to prevent the vial from spraying liquid out. Next, I'm going to inject that small amount of air, then pull back on the plunger. But one thing to notice here is the angle of the needle and where the bevel is located in the vial. When you're trying to get that last drop, you'll want to have the needle bevel just inside the vial facing down to capture that last bit of liquid. But as you can see, even with good technique and practice, there is always a tiny drop left in the vial. And remember, I was actually trying to withdraw every last drop.
Well, thanks, Seth, for that. That was incredibly helpful. And just a couple of extra points to help reinforce what Seth showed us. So first, let's show an example of what not to do. So here we've got a COVID-19 vaccine vial. We're almost out of vaccine. We just have a little bit left. And as you can see, the needle's inserted a little too far into the vial. And obviously that's going to result in air being drawn into the syringe. And of course that results in potential for wasted drug if the needle's not repositioned to get those last couple of drops out of the vial. So what's the right way to do it? Well, Here's the right way. You want to have the needle inserted just past the vial stopper. As Seth said, you want the bevel of the needle to be pointed down, and this will result in retrieval of as much drug product as possible, minimizing waste. The only thing to be careful of here, well, two things to be careful of here. Number one, obviously, as you're manipulating the syringe, needle, and vial, don't accidentally withdraw the needle from the stopper. It's easy to do that. And it's tempting sometimes to really try to get into the corner of the vial. And if you're too aggressive with that, you can actually bend the needle. So again, don't be too aggressive there. As Seth pointed out, there will always be a drop of liquid left in the vial. We just want to make that drop as small as we reasonably can. All right, so that will wrap us up for today. Hopefully now you have a solid understanding of dead space, what dead space is, and you have a good understanding of why we need to be using low dead space syringes and needles, and the types of manipulations you can be doing to help maximize the number of doses that can be drawn up from COVID-19 vaccine vials. Until next time, thank you very much, and we look forward to meeting your future COVID-19 education needs.